I'm Vicki Liviakis, and welcome to Body Beautiful. It's our weekly show where we talk with local doctors and other professionals about the latest in cosmetic procedures, and we take your calls live on the air. With us today, we have plastic surgeon Dr. Joseph Mele, followed by Michelle Miller, who owns Simply Beautiful. And we'll explain that later on. Also later, we'll be taking your calls and emails, answering any questions you might have. Here's the phone number, 800-440-4884. We'll also be posting the phone numbers to the doctor's offices, so be ready to jot those down. Now, before we get started, any advice we give you today, obviously, you're going to want to consult your own physician. Welcome back, Dr. Mele.
Thank you. Nice to be back.
Well, you are a board-certified plastic surgeon, which is very important when someone is shopping for a plastic surgeon.
Yes.
That's one of the first things you look for, is it not?
It's very important. It means that your surgeon has had proper training and that there's been some review not only of their training but also of their practice after training. There's certain certification exams that are required, both written and oral, as well as review of cases that are done. So it's pretty thorough in order to be a certified surgeon. And it's now ongoing. It used to be that you were board certified once you graduated and that was it. Now, every 10 years there's an exam, and every couple of years there's other paperwork and reviews that are done. So.
And you are board certified and proud of it.
Very happy to be board certified.
Okay. Dr. Mele, I mean, let's face it, we are a breast-obsessed culture.
Well,
are we not?
Some more than others, yes.
Okay, but the breast augmentation surgeries, but this seems to be kind of the, is that like one of the #1 plastic surgeries being performed these days?
It is. Liposuction usually is #1, but breast augmentation and eyelid surgery are usually 2 and 3, sort of neck and neck, though the breasts have been in the lead lately. Part of that may be approximately 1 year ago, the FDA re-released or remove the restrictions on the silicone-filled breast implants.
There was a lot of concern about that. That has now gone away, but the saline implants are still available for folks.
Well, they're still available. What's interesting is about prior to all the controversy, about half the implants used were silicone and half were gel, or half were saline, and we've kind of gotten back to that. After a year, we're pretty close to 50-50. I know it is in my practice, and talking to other doctors and talking to the manufacturers, that's about where we are again.
All right, now you talked to me off screen here a little bit about something new the FDA may be considering. Can we talk about that a little bit?
There is. The manufacturers can't talk about it until it's approved, but I can talk a little bit about it. And it's not completely new in that it's been in Europe for 8, 9, 10 years now. When there was restrictions placed on implants, this was 15 years ago, it took Europe about 6 months to re-release the gel implants. It took us about 14 years, so we were a little slower. During that time, other developments were made, and one of the developments was surgeons noticed it was easier to clean up after a ruptured implant that was full of gel if it was stickier inside. So that thought process was taken one step further, and now there are implants that are actually a solid. It's a soft solid, sort of like a stress pillow, stress ball, but they're made solid so they can be made of different shapes, and they never leak. And there's going to be a huge advantage, I think, for patients who are undergoing reconstructive surgery, who we need to form a shape to the breast because the skin just doesn't give us that right shape anymore.
So this would be after a mastectomy.
After
you want
mastectomy.
Something that actually has the shape of the breast.
Because with the implants that we have now, the skin really determines the shape of the implant. The inside is fairly liquid, fairly fluid, and if the skin's been removed, we end up with a fairly flat breast. We don't end up with a lot of projection. With these, we can enforce the shape with the shape of the implant. They come in 16 different shapes, different heights, widths, volumes. It's very, very fascinating, and I'm looking forward to being able to use them soon, but I don't know when they'll be released.
Okay. Well, I'm sure you'll keep us posted about that. Say a woman is considering breast augmentation or a breast lift. I mean, what's the difference? And
Augmentation has more to do with increasing volume. Again, since the shape is mostly from the skin, the lift is to change the skin. And changing the shape of the skin will do a couple things. One is bring the nipple up higher on the breast if it's dropped secondary to weight loss or childbirth. And it'll also change the shape if there's some sagging of the native breast tissue.
Okay, now you brought some before and after pictures. We've got emails and the phone lines are already lighting up. We want to address those, but we need to go to a break.
Sure.
So in the meantime, if you want more information about Dr. Mele, you can call 925-943-6353.